Hello, everyone, and welcome back to the 7th edition of As the Virus Turns, brought to you by the Alzheimer's Association. This week, we have 3 facts regarding the prevalence of Alzheimer's. Almost 2/3 of Americans with Alzheimer's are women. Also, older Black Americans are about twice as likely to have Alzheimer's or other dementias as older whites. And lastly, older Hispanics are about 1.5 times as likely to have Alzheimer's or other dementias as older whites. Next week, we'll continue on this topic with information from our special report on race, ethnicity, and Alzheimer's in America. As always, to learn more, go to alz.org/facts. I'm Doug Pace, and I'm back with Marty Moore. Marty, there were new requirements released this week. What can you tell us about them?
Well, Doug, there was, and CMS, it continues to try to grow its support and understanding around vaccination and COVID-19. And so here's a couple things that we need to know. One is that they've given these requirements, they're in alignment with existing requirements for influenza and pneumococcal. So, in some ways it's going to feel like you've done this before, but there is a couple things. One is they require education of residents and staff about COVID-19 vaccinations, and to offer those vaccinations if available, you need to document that. Secondary to that, and this is where it was a bit confusing, and I actually had commented on it, that I thought it was a later date of start. It's not. So the rule is that long-term care facilities have to report weekly COVID-19 vaccination status data for both residents and staff, and that's due by June 13th, and then needs to be done on a weekly basis to the National Healthcare Safety Network. Additionally, that data is going to be public, and so as they collect more and they start to build the database, it then will become available on the nursing home data website. So that means there's some different conversations, and I know the call has been is not to judge those that have low vaccination rates. There's many complex issues that go into those vaccination rates, but it also does call the question around what does public data mean, and how will that be reflective upon those that may be looking at the care and services there. So more to come on that one, Doug, but yes, there's some changes arriving, but there's also some interesting things happening.
Well, great. Well, this is really important information that will help the public be more knowledgeable about vaccine details in nursing homes. Is there any research and updates that we need to be aware of?
Well, I gave you a little teaser right there when I said there's some interesting things happening, and yes, there is. And so obviously we've seen on the news that Pfizer has gone for full FDA approval. What I'm hearing is that's expected to be completed by this summer. So, that's great news for those that were hesitant because they didn't feel or totally understand the emergency use authorization. And then additionally, we've also seen that Pfizer has been approved for younger populations. Here's what's really interesting is that the vaccine, when we do an injectable, we in essence elicit kind of a systemic response, this immune response. And what we've known all the time is that COVID actually likes to kind of live in the nasopharyngeal area. So it's an area where it's able to replicate itself and then, kind of distribute itself throughout the body. And what they're looking at is hey, can we develop a nasal vaccine that can stimulate the immune response of the mucosa? So that in truth, you're kind of isolating that virus before you have this total systemic response. And I think that's going to be really interesting to see how that weighs out. Now, Doug, the reason that this is exciting is because there's some variant changes that have occurred out there. And so, we talked about the variant that's over in India, and we've identified the fact that it has 2 mutations. Well, the World Health Organization actually just changed that variant from a variant of global interest to a variant of global concern. Now, why is that? Well, what you understand now is it spreads more easily, it's less receptive to our neutralizing antibodies, and there's severity of illness associated with it. This variant, B.1.617, has already been identified in 30 countries, including the US. I think there's more cases here than what we've identified so far. I think you'll hear more and more case counts coming out as we're doing the sequencing. But here's why I want to call an alert. And if you remember the UK variant, it was kind of like it was out there. We certainly were seeing it in the United Kingdom. We heard a few cases here. And now it is the most dominant, prevalent variant across the United States. And so that is why the variant that we've identified over in India bears to be watched. You have to keep your eye on it because it can go from being one with low cases to one that's the most prevalent.
So what should our listeners be thinking about from these updates?
Well, the first thing is one, make sure you have your systems and processes to record, document, and meet the requirements that CMS is asking. The second thing is really engage in conversations around vaccination. And for those that still have questions or those that are still watching, there's more and more information that's now coming out that is easily obtainable and is really grounded in science and answers questions that people might have from it. And then, the other thing is, and boy, Doug, I'm seeing this everywhere that I go, is people are letting their guard down. It's almost like, okay, we're done, moving on. And the variant's going, please do let your guard down because that's how I survive. And it doesn't want to move on. It wants to survive. So don't let your guard down. Continue with your precautions, continue with the things that you've been doing. As I always say, and I know I'm a broken record, we're not out of this yet.
Well, Marty, as always, you've given us a lot of great and timely information. Thanks everyone for tuning into this week's edition of As the Virus Turns. See you next week.